So you're sitting in your chair watching this video, but how are you able to see what's on the screen, hear what I'm saying, and shortly stand up and give your own SGL presentation? It's largely in part due to the billions of nerve cells that make up your central and peripheral nervous systems and their ability to receive input, send impulses, and stimulate effector cells that you, along with many other organisms, are able to live your daily lives. In order to understand the physiology of nerve conduction, some fundamental information is required. The selectively permeable nature of the cell membrane allows for the unequal distribution of ions across the membrane, resulting in the creation of a resting membrane potential. Most important are the concentration differences of potassium and sodium ions. There's a higher concentration of potassium inside the cell, and there's a higher concentration of sodium outside the cell. To make a long story short, a cell at rest has a resting membrane potential of about -70 millivolts, mostly due to the fact that at rest, the plasma membrane is much more permeable to potassium, allowing potassium ions to diffuse down their concentration gradient to the outside of the cell, leaving the intracellular space negative. Evoked by neurotransmitters, a nerve cell at rest receives subthreshold alterations in membrane potentials called graded potentials. If there is sufficient temporal or spatial summation of graded potentials across a neuron, a threshold depolarization will be reached and an action potential will fire. An action potential is the transient increase in the permeability of sodium ions across the nerve cell membrane through voltage-gated sodium channels. A rapid membrane depolarization ensues, and there's a subsequent unidirectional wave of this phenomenon down the axonal cell membrane, ultimately leading to a release of neurotransmitter at the synaptic terminal. The resting membrane potential is re-established by the desensitization of voltage-gated sodium channels, the opening of voltage-gated potassium channels, in addition to a contribution by the sodium-potassium ATPase. Surrounding a nerve cell axon is a myelin sheath, which acts as an electric charge insulator. It is at breaks in this sheath, called nodes of Ranvier, where action potentials occur. Action potentials jump from node to node, which is called saltatory conduction. Now that we have an idea about the basics, what can go wrong in neuron signal conduction that can lead to bilateral peripheral neuropathy, specifically peripheral tingling? Increased systemic fluid pressure can cause focal demyelination at a site of compression, resulting in neuropraxia. Neuropraxia is a block of nervous transmission that can be reversed. If a nerve is demyelinated, the propagation of nerve impulses is diminished through the loss of saltatory conduction and the dissipation of the wave of depolarization down the axon, which would present as a unilateral but often a bilateral peripheral tingling sensation in a patient.